My name is Lyndsey Pangburn. I'm a clinical specialist physiotherapist for BTH. I've been a physio for about 11 years and I've worked in this trust for nearly 2 years now. I work in Central West neighbourhood as a community specialist physiotherapist, working alongside nurses, occupational therapists, health and wellbeing workers, matrons and case managers. I first wanted to be a physio when I was 11 years old, and that was because I had family connections within the health service. My auntie was an occupational therapist, so I learned a lot about what therapy can offer patients through her line of work. Spent a lot of time with her, and sort of in and out of work, learning about what that could offer different people, and found that it would be a really rewarding career and wanted to look more into it. So when I did that, I just found that physiotherapy would be something I would really be interested to look into, and yeah, pursued that career from a really young age. The thing I love most about physiotherapy is the diversity of the job. Admittedly, when I first went into the degree, I thought I knew a lot about it, but actually realised I didn't know very much about it. Enough really. I had so many different placements in various areas of physiotherapy, from women's health, paediatrics, respiratory, working with patients who'd had a stroke, patients who'd had falls in the community, and just really quickly fell in love with how much variety the profession had to offer, and how much we could do for patients in general. I work in the integrated neighbourhood, so it is a case of trying to work beyond the scope of physiotherapy a little bit, and working, trying to pull skills from different areas as well, just to offer more for patients. But as a physiotherapist, what I'm going into a patient's house to help them with is to maintain their independence as much as possible, try and help them regain as much function and independence as they can, and empower them to self-manage long-term conditions in their own home and prevent those sort of hospital admissions as well. My background is respiratory specialist, so I really enjoy, I've got a passion for respiratory, I really enjoy that side of things, and so quite a lot of my caseload is to help those patients become empowered in managing their own condition, with lots of different breathlessness management techniques and sputum clearance techniques, and I feel that that's a service that I can offer to patients that not many other people could in the neighbourhood. We are looking, as we have been since the neighbourhoods were developed, to really try and put some effort into making it a rehab service for the patients. So making it rehab focused, trying to allow the patients to feel that they're being involved in their care the whole time, and setting those sort of goals with the patients as well, and making it feel that we're actually providing a really effective rehab service, as well as being able to promote their independence through use of equipment and things like that. I think obviously there's things changing all the time in the neighbourhoods and sort of within the closer services, but what would be nice to see would be closer links and improved relationships with external services, maybe sort of the council or more private services in the wider community. I think those closer relationships would really benefit the patients, and allow those relationships to sort of grow and develop over the next year.